We do have special considerations in measuring blood pressure for accuracy. Remember, a patient's only diagnosed with prehypertension or hypertension if they have the same reading 2 visits in a row. There are factors that can come into play that can cause variations, and that's why we give the patient 2 opportunities to have a normal reading. If they're coming to the doctor's office, they may be feeling anxiety, stress, they may have been rushed, maybe they were running late for that appointment. Those things can definitely alter the reading and blood pressure. A lot of it too has to do with how the patient is sitting when you're obtaining the blood pressure. If they're sitting and their legs are crossed, that can elevate a patient's blood pressure. So if you're doing a reading or obtaining a reading and you notice that the numbers are abnormally high for this patient, especially with their baseline, go ahead and do it again. Check their feet, make sure that they're flat on the floor, that they're not crossed. Maybe they're suffering from anxiety or stress. If that's the case, we could pause and we could do the blood pressure reading before they're discharged. After they've seen the doctor, we could do it again on the way out just to verify. You may ask the patient, are they post-exercise? If they have ambulatory disabilities, that could also increase blood pressure. They're working a lot harder using crutches or a wheelchair or a walker. Definitely going to increase the values there. Obesity is a big play in high blood pressure as well. So that could also be a factor. They could have previous heart conditions or blood pressure issues before. That could be a factor. And as I mentioned, the anxiety and stress could also raise those numbers. So all another reason why we would do it twice within the visit and then compare it to what their normal baseline is. Now, there are circumstances where we would want to avoid measuring blood pressure in a patient's arm. The very first most important reason why we would avoid the area is if they have had a mastectomy. Mastectomy is a breast removal or breast reconstructive surgery. If they've had it on their right side, we absolutely don't want to obtain a blood pressure on that side. It could cause excessive swelling or unnecessary swelling and discomfort in that location. If they've had a double mastectomy or a double breast reconstruction, we have other areas. We have what's called a thigh cuff. We can obtain a blood pressure using the patient's thigh. In that case, both arms would be off limits. If they've had an injury or a blocked artery, if they have an implanted device, maybe a pacemaker, maybe a catheter put into place for dialysis, definitely going to want to stay away from that area as well. So also watch your cuff sizes. Notice here in the picture, we have a small, medium, and a large. And then there's another one that's not shown in this photo, and that would be an extra large, which is really a thigh cuff. You're going to have to evaluate your patient and try to estimate what would be the best cuff for them. But just know that if you use one that's too small, it's going to squeeze the arm a lot tighter if it doesn't pop off. And it's going to cause you to have an artificially elevated range. If the cuff is too large, it won't fit properly. It's too big. So we're not getting the appropriate pressure there. That could cause it to be artificially low. So watch your cuff sizes also. And if you do choose a cuff and it isn't the right size, not a big deal. Go ahead and do it again. Maybe use the other arm and try to find the correct size cuff for your patient.